So I am here in Wasilla at the look like a hair model. So I was just like, are you going to deny me public assistance because I look too good? But I was in the hospital a couple times. I got some prescription medication, a you know uh, for me from the doctor, and I can't get it. I've got Medicaid. I'm supposed to be able to get the prescription meds for my injury or whatever, and I'm actually in pain here. And I was originally in the hospital on the 9th. The second time was the 17th. The issue is with Medicaid. The Medicaid system is kind of fucked up because Medicaid approved me on the 9th when I originally was in the ER for the 2-month coupon, and I've got the stuff here. I'm not going to put it on the screen, and it says that, and then it went through the system, and on the 11th, on the 17th, I was back in the ER, and I got prescribed the antibiotics at that point. I also got an antibiotic shot, and public assistance state of Alaska. Yesterday I was on the phone with the people, a woman, Charlotte, at the Medicaid in the Medicaid person, and she said that she called me back after talking to me. She said it was in the system and that it would be eligible for me to pick up the antibiotics at the Walgreens tomorrow. But as it works, there's a separate system, and then she said you go over to the public assistance if you want. State of Alaska, they're the ones that need to enter into the system or whatever. So I go over to the state of Alaska and wait in line for an hour at public assistance here, and with my injury and sitting there in pain, and the state of Alaska says brings me into this back room, this sort of shady back room. You can see Masilla, they've got another whole office with a locked door. They've got security. It's really sort of sketchy, to be honest. Why do you guys need the security? Why do you guys need to be in a back room with the locked door? And then they print out the form or whatever saying that I'm on the thing, and they almost look smirk about it, and they print off the form saying, well, and she types in, your temporary presumptive hospital Medicaid eligibility is no later than blah, and will end no later than that for the 2 months, July and August. And so I'm like, okay, we're just trying to get the medication, we're not trying to, rethink systems or start battles. But she says, well, you can take that down to Walgreens. They might just give you the medication. So I waste my time again. Now, just remember, the first person who wasted my time was the people at Medicaid who told me on the phone yesterday that I would be able to pick up the medication today, which is, a lie on their part because it is not. I'm not able to pick it up today. So they gave me bad data, incorrect information, and wasted my time. And this happens all the time in the state of Alaska. This happens to all these people, not just me. I just want to point out. So now today, they say that it's at the state of Alaska. I talked to the Medicaid people again. I have to talk to a supervisor. I talked to a guy, Dan B or something, Dan something, and then Brittany, a supervisor at the Medicaid. I know they won't give me their last names, right? But we're giving them all our information, and I just want the continuity because today when I talked to Dan, he's like, "Well, who did you talk to?" And I didn't know, and I called back 2 or 3 times. Finally, I got the Charlotte phone. She said, "Yeah, I talked to you yesterday." So here we are, just trying to get the system to work, and then I go into the pharmacy because I was in the pharmacy yesterday, and then today, and then again today after getting this thing printed off the state of Alaska public assistance that confirms the Medicaid, and here we are, and he says, well, it needs to be in our system. Our system's a separate system. It's Xerox, quote unquote, just like a Xerox thing. To me, that just seems so sketchy. Why is it called Xerox? Why is there a separate system, a private contractor that does the billing or whatever, where I'm just simply trying to get the system to work for me so that I can get the antibiotics that have been prescribed? The antibiotics prescribed on the 17th, but remember, I was originally in the ER on the 9th, so I really need those antibiotics to get in my system as fast as possible. I don't need to be stressing on this. I don't need to be fighting bureaucracy and shit. I just need the meds, you know what I mean, for the right response time with regard to a follow-up with the doctor as well, to try to just do R&R and get the antibiotics and put them in the system and slow down and do less working out, etc., and less less sitting. I shouldn't be sitting here. I should be lying down somewhere. So here we are. So I call up Xerox after coming back to public assistance here after going to the Walgreens. Here I am driving around, wasting my time doing all this shit. Medicaid told me that it would be in the thing. It's not. Why did the public assistance people again tell me to go over there with their thing? It's not going to work. They know it's not going to work. Both Medicaid and State of Alaska Public Assistance have wasted my time as a taxpayer, as an American, as an Alaskan, and are giving me fraudulent data because they're telling me that it would work, and it's not working when I try to get the medication that I'm eligible to get. So their third party, Xerox, needs to put the data that is in their system, and I called them and left a message. At this point, on a criminal level, both Medicaid and Public Assistance State of Alaska are criminally negligent because that data needs to be in the pharmacy situation. However it needs to get in here, I'm not responsible for taking the data from the direct care provider doctor at that Matsu Regional Hospital and making sure that I can get the patient can get the antibiotics that have been prescribed. That's not a patient's responsibility to do that. You see what I'm saying? So we are at a moment culturally, where, and these people just want to play the game. They don't want to follow through. Oh, you can buy that. No, I can't buy that. And no, I'm not going to buy that. You need to have a system to work for a citizen underneath our American flag. This is healthcare. This is not. This is not trigonometry, but why has it become trigonometry here in Alaska, where we've got Medicaid, we've got the state of Alaska, and we've got our a third-party contractor who can't enter in a timely fashion the data as it's been approved for the Medicaid. It's a real problem, and it needs to get. I think it needs to get addressed and it needs to get fixed. And if Xerox, as a third-party contractor building the system, doesn't want to do it the thing right, then they need to get replaced by a third party with a competitive request for proposal process that will ASAP, as soon as that is approved with the state of Alaska, and as soon as that shit is Medicaid is approved, that American citizen, that Alaskan citizen, that client should be able to go in there and pick up their medication. They don't need to wait 3 days for the data to go to Xerox. They don't need an excuse from Medicaid. They don't need an excuse from the state of Alaska Department of Public Assistance, because those people, all of those people, are paid, and they're paid to do a job and to get a American citizen, an Alaskan citizen, a medication that a doctor has prescribed for them is treatment for an injury or disease, and they need it in a timely fashion, and they don't need it 2 weeks later. And if you're not going to deliver upon the contractual agreements, then Xerox, the third-party billing contractor or whatever, that needs to approve getting billed for the medication so the person can pick it up, they need to be replaced as a provider, and they need to be, as well as the Department of Public Assistance, as well as Medicaid, taken to court, and they need to be held, fiscally, financially responsible for that, because the hard reality is, those people that are all getting paid, they need to have a system that works just like that. They don't need 3 to 5. No, that needs to work. And if you don't want it to work, it's as simple as it's as simple as anything. As soon as one system's updated, the other system needs to be updated. I don't think that there needs to be a manual entry. I don't think that there needs to be 5,000 phone calls. I don't think I need to be misled willfully by people at Medicaid in Anchorage, by people at Public Assistance in the Valley. I don't think those people, if that's not going to work for me, they need to tell me it's not going to be working. I need to be told right at the beginning to go ahead and try to contact the third-party thing, Xerox, to get it done. And why do I have to talk to a third-party business? And if the business is not doing it with continuity in terms of a timeline, with the approval from the doctor and with the implementation and adding into the system by Medicaid and by the state of Alaska, then and I think there's faults in both of their processes too, not just Xerox. But then that third party really does need to be replaced, I think. And again, no one is in this to try to start a battle. No one is in this to try to get involved in the system or to get upset about it. But we need a system that's going to work for an everyday American, an everyday Alaskan. When you have an injury, when you have a disease, or when there is a treatment and a modality for treatment, like an antibiotic that's been prescribed by doctors, then those American citizens, those Alaskan citizens, they need to be able to access that healthcare. And when that healthcare, when that system says that it's their right under law for them to be able to access it, and in that timely fashion, and then we have a third-party contractor, Xerox, and we've got Public Assistance at Alaska, and we've got Medicaid that are not delivering upon the promise of their contractual agreements with that citizen under the law, then you've got not just the flawed system. You've got people who are criminally liable for their inability to deliver upon what they are contractually, basically, essentially paid to do. So to me, it's more than a travesty of justice. You know, I'm in pain, and I want not just for me, I want for the system, for all of the Alaskans and for all of the Americans to have something that's going to work better than that. And you know, to me, it's criminally negligent for the state of Alaska employees, as well as for Walgreens, and you know, and not Walgreens, but for Medicaid in the state of Alaska to do this, to lead the person in all these different directions right at the beginning. Say, this is what happens to everyone. They need to go to Xerox. It's a bullshit. You know, it's a bullshit process, and just be direct and honest about what's going on. But they're not being paid to do that. They're getting paid to have people run around 5 different times, call 5 different times, and waste their time, which is really, I think, it's a real problem. It needs to get fixed.